Another question is, how can we avoid over-testing the community? We know that 42% of all men have microscopic cancers, yet only 16% of men develop a cancer worth knowing about, and only 2 or 3% of men die of cancer. So we don't want to pick up all the low-grade cancers which are never going to come against you. So how can we minimise the over-testing? It's been suggested that a PSA at the age of 40 can help predict an individual's likelihood of developing cancer in the next 25 years. So that's one way. So if your PSA is greater than 0.6 at the age of 40, you have a greater chance of developing prostate cancer than a person whose PSA is less than 0.3 at that age. And clearly, the person whose PSA at less than 0.3 doesn't need to be tested as frequently, and in fact may only need to be tested again in 10 years' time. The other way of decreasing the frequency of testing is looking at the older age group. If you reach 60 and your PSA is less than 1, you have no chance of dying of prostate cancer in the next 25 years. If you reach 75 and your PSA is less than 3, you have no chance of dying of prostate cancer in the next 25 years. So in that group, it may be reasonable, after discussion with the patient, not to continue PSA testing, and that would save the community a lot of money, and it would avoid unnecessary anxiety and testing. So that leads me to testing the people who need to be tested. And who are they? It's people who have a family history, people whose PSA is elevated at the age of 40, and people who are particularly anxious about PSA or cancer of the prostate, in which case we need to test regularly and monitor the PSA change over time. And that's the best way of picking up early and curable cancer. So what's the evidence that doing this will have a benefit? Recently, the Swedes reported a 14-year follow-up, which is the longest now, in a proper randomised controlled trial, which is the highest level of study, and showed that the death rate from prostate cancer after 14 years of follow-up was decreased by 44%. We strongly believe that the longer we follow up this trial, the bigger the difference will be, the bigger the benefit will be for people who have been tested. So this trial has put beyond any doubt that early detection will save lives. Our biggest challenge is to make sure we only look for the more aggressive cancers and only treat the more aggressive cancers.